a relatively successful treatment, a beneficial treatment, a person's symptoms start to recede. The anxieties and the hypervigilance starts to diminish. The avoidant behaviors of isolating from the world start to diminish. The reenactments, that's the third category of symptoms of trauma, that starts to be fewer and less intense. So it's as if we experience and remember the trauma, but we don't fully live it again. There's a saying with trauma that time stands still. In other words, that trauma is indelible in our psyches. And once we relive it, it's as if we're still there. With a relatively successful treatment, we start to move from that and resume normality in our life. We start to engage others. We're back to being productive workers. We start to experience fulfillment again. Our life isn't just about survival anymore. Because once you're in that post-traumatic phase, where you're reliving the trauma, life is about survival, as it should be. Once you move out of that, you start to experience the perks of life, the joys, the fulfillments of life. But trauma is indelible, and we don't want to forget trauma, but we don't need to relive it all the time. It becomes a memory, and the expression that with pain you build character. There's growing pains in life, and eventually a trauma, once we start to more fully heal from trauma, and it is a process, once we start to more fully heal from trauma, we actually can strengthen our character. We've been through something, and we've been through it with a caring therapist, and maybe perhaps some other loved ones who really start to understand. We've been through it with them, and we know that we've been through it. And that can build our character, make us a stronger person, more able to help others, more able to contribute to humanity.